Hello, my name is Jane Ramsey and I'm a consultant obstetrician with an interest in diabetes. I really just wanted to talk about our service for women with gestational diabetes, which has changed over the last few years that I've been working in the service. Initially, when we started screening large numbers of women for gestational diabetes, when they were diagnosed as screen positive, they fed into the normal diabetes clinic with type 1 and type 2 patients, and effectively the numbers were so large that they had a very long waiting time to see a doctor. They had to sit for the whole afternoon to wait to be seen, and then perhaps we'd only have a couple of minutes to spend with them, review their blood sugar monitoring, and then they were sent away for maybe up to a month before they would be advised again, which meant that they didn't really get as much in the way of dietary advice, they didn't get as much in the way of proactively adjusting their diet or starting treatment in response to what their blood sugars were, so that often we were missing the boat with regards to the improvements that we could make, and also it was not a good service for the women who were very frustrated, and it probably impacted on more complex patients who were at the same clinic. So we have now got a lead midwife in diabetes who's gone through a degree of training, and she runs a sort of telehealth service for these women once they're diagnosed. So they have a diagnosis made at a glucose tolerance test where they have dietary information and advice, and that is given independent of whether they screen positive or not, so that's one good step. Secondly, as soon as they're diagnosed, they're up for more focused information, and they have weekly, sometimes twice weekly, telehealth reviews so that we can proactively initiate more significant treatments if required and escalate that up the system to make sure everybody's getting timely and correct management of their gestational diabetes.
Hi, my name is Noreen Dennehy. I'm lead midwife for diabetes at Ayrshire Maternity Unit, and my passion is looking after ladies with gestational diabetes and trying to give the best care we can and improve the service. I've been looking after ladies with gestational diabetes probably for about around 10 years, and with changes in the guidelines, noticed that there was opportunities there to improve the way we deliver the care, to make things better for these women. We're finding that through the changing guidelines, the amount of ladies diagnosed with gestational diabetes was increasing, and felt that the care we were able to give was maybe not consistent, and there was improvements. There was opportunity for improvements to be made. As well as improvements for the women, we also saw benefits to the service, as well as the staff working within the unit. Based on feedback from our ladies, we decided to redesign our service. This has resulted in not only benefits to the ladies themselves, who are more able now to manage their condition without the use of any medication, but also it's given us a good opportunity to benefit the staff who are working within our department. We've managed to deliver better education to the women. This has also allowed us the opportunity to offer better training and development for our staff to increase their skills and be more confident in working with women with a medical condition in pregnancy. Gestational diabetes gives us it provides a key opportunity, a timely platform to deliver education for women that they can take on board, and not only for the pregnancy and for delivery, but also their long-term health. It's allowed us to develop the roles of our healthcare assistants, becoming more involved in direct patient care, which in turn increases their job satisfaction. They're enjoying working with the women, and the women can relate sometimes better to the healthcare assistants and sometimes the medical staff. They feel at ease more to be able to speak to them and are more open, and I think it's that open relationship that we have with the women that gives us the better results. They feel as if they're just having a chat with the staff, and it's not like a patient-staff relationship. I think that becomes more evident in our telephone calls where we're phoning the women. The fact that we can phone them saves the time. They don't have to travel up to hospital, they don't have to sit at busy clinics, and I think when they're sometimes into their second and third pregnancy, when they've got other children to look after. They don't have to come all the way up to hospital. They can speak over the phone when it suits them. They can do phone clinics, and they can have a general chat about various pregnancy related issues, as well as getting information on how to manage their condition. And I think that's a benefit to the women. So although we are delivering the education, it's the women themselves that are making the change, and I think they begin to realise that they can make the difference, they can make the change, and they can sustain these changes for their long-term health.
I'm Ailey. I'm currently in my second pregnancy. I've had gestational diabetes in both pregnancies, both times diet controlled, and I've got a wee boy who is just coming up 2, he's about 20 months, and I'm 38 weeks pregnant in this pregnancy.
Go back to first pregnancy, Ailey. What were your expectations of coming for the test when you were advised that you needed to come for a glucose tolerance test? How did you feel about that?
I suppose I was a bit embarrassed, thinking that because of my BMI that I had to kind of have special treatment. But then when I came along, the staff made it clear that this wasn't a shameful thing, it was a kind of positive thing, and it wasn't as if they were there to criticise or judge you for coming along for this, and there was lots of different reasons that people were there, so it wasn't like it was you were being shamed for turning up. It was just, this is something that we need to look into. If we look into it, we can manage it, and there's lots of different ways of doing that, and then that was quite reassuring. I was, I suppose, surprised when I got the phone call to say, oh, your levels were a bit high, because you're always hoping that you're going to just sail through it and be fine. But actually, I think it was quite a positive thing, because it wasn't as if I was unaware that my diet was full of bad things, and it gave me the incentive to kind of change that. And really all I had to do was monitor my sugars throughout my pregnancy, and there was, that was an easy thing to do. I think it kept me on track, and it was kind of reassuring at the end of the day that the baby was not getting exposed to too much sugar or other bad things.
So when you came along for the glucose tolerance test and you took part in the group education, did you feel that was a benefit?
Absolutely. It was quite a big group, and to begin with I kind of thought it might be a wee bit intimidating, but everyone joined in and everyone had different perspectives, and I think that made it easier rather than a one-to-one where you kind of feel more under the spotlight, and people shared different experiences, and no one was there sort of setting themselves up as being perfect or better than the rest of us, or so that was, I think that made it kind of, you felt less like you were different from all the other people who were pregnant, because there was a big group of people there who were in the same situation.
Ailey, can you tell me a wee bit about how you felt when you came along to your meter demo appointment? Just your feelings round about that day, because obviously that is not an individual appointment.
I mean, the person who went through it with me was very patient, because I'd never done anything like that before. But I suppose because I'd already been to the session, the group session, I felt that I kind of knew, apart from checking the blood sugars, which I was taught how to do, and that was fine, I kind of knew really what I had to do and how I had to do it, because I'd already had the group session, so it was, I didn't feel kind of shocked or scared. It was more just about a kind of practical bit of it, so that was much less of a concern to me. And I think the second time, well, with this pregnancy, when I came along to the group and there was a couple of mums there who were really, really anxious, And I was able to say to them, do you know, this happened to me the last time. All I had to do was check my sugars. It helped me make some positive changes in my diet, so there's nothing to worry about. And I think it's a really good way of doing it so that you kind of are aware of what's going to happen.
The day-to-day monitoring of your blood sugars, how did you find that?
I suppose the only thing that I found difficult was when I was still at work, you know, getting the time to make sure that you were checking an hour before lunch, an hour after. It's easier when you're on maternity leave, but the fact that there's a bit of flexibility in when you check, you're not having to check every meal, you know, if you suddenly find that, you know, it's 3 hours since you had your lunch and you've not checked, you can check it before your dinner or after your dinner. So I think the way that's set up, it can fit in with most people's lives. I don't think I think it's set up for people who are out and about, you know, you've got your wee mini toolkit as it were, so I think practically it's quite easy. It would be nicer not to have to do that, but I suppose that's also an experience because you're thinking, I want to have to do this in the future, so it's another incentive to get kind of your weight and diet under control.
Ellie, we'll move on and talk a wee bit about the reality of when you were monitoring, about the support. How did you feel the telephone clinic went on a week-to-week basis, and a bit about the support during that time?
Again, that was really flexible because you would arrange a time for to catch up on the telephone, but it wasn't always possible to speak at that time because obviously things were happening with the staff, and also I was still working earlier on in the pregnancy. But because it was flexible, you could always catch up, you know, later that day or the next day. And the fact I didn't have to come to the hospital made a huge difference. It's an hour from my work to the hospital, so having to do that once a week would have been a real kind of, you know, difficulty juggling that. And also, I don't necessarily want to have to say to my colleagues why I'm having to go to the hospital every week. So the fact that it was a phone call was, it kind of made it easier. And I think the fact that the staff, it was the same staff that you had met that were phoning you, and so they got to know me, I got to know them, and I knew that I could phone at any time if I was concerned about anything. And again, it takes a bit of the formality out of it, you know, chatting to someone on the phone rather than having to come up to a clinic appointment. So I thought that worked really, really well. And the last time and the same this time, it's been exactly the same. It suits me much better. And it's much, in terms of time, I've now got a wee one, so juggling all that would be much more difficult if I was having to come up to appointments. Having said that, I knew that I could come up and be seen if I felt I needed to.
Hi, I'm Cheryl. I have 4 pregnancies. My first and my last pregnancy, I didn't have gestational diabetes, but my second and my third, I did have gestational diabetes.
Can you tell me a wee bit about the difference between the first pregnancy and what happened in the first pregnancy and the second pregnancy? How you felt about having gestational diabetes?
It was a bit of a shock because I'd put on a wee bit of weight from my first pregnancy, and then when I fell pregnant I didn't think I was even going to get anything like that. I never heard anything like that, and then I got the test, but it was a wee bit later on I got the test, so it was caught a wee bit later and I had to go straight on to like insulin, metformin and then insulin. But with my third pregnancy, it was caught earlier, so it wasn't like as bad, if you know what I mean. And the fourth pregnancy didn't have it at all.
And was there any difference? You said you gained some weight for the first pregnancy and the second pregnancy, and here you are just had your fourth baby, and were you tested in your fourth pregnancy for gestational diabetes?
Yep, I was tested earlier as well, but it came back clear, and then I had the second test and it came back clear as well, so I didn't have it. It was in the normal range.
And obviously you've been in the service a good few years, Cheryl.
Yep.
Have you seen some differences in how you received the care?
The second pregnancy, because I was tested later, I think it was 28 weeks or something, maybe even a wee bit longer than that, but it took a while before I got like the meter, before I got everything else. It was all like a big long drawn out kind of thing, so the time I actually started getting proper treatment, it was already too big. So with the next pregnancy I get tested earlier, I think it was 16 weeks I get tested, and they caught it a lot earlier, and it was managed, and he was a lot lighter than what my second pregnancy was. So I would say the second pregnancy was a long drawn out thing. The third pregnancy was more manageable. They were on top of it quicker, and there was a lot of kind of phone calls more than having to come up to the clinics all the time.
So did you find that beneficial, just having someone phoning you rather than coming to a clinic?
It was a lot better than having to travel and then sit for hours at the clinic. With my last pregnancy, I came along to the GT for my GTT, but there was a group education class where they talk about portion sizes and how it affects you if you've got it and everything like that. But although I didn't have gestational diabetes with my last pregnancy, it was actually quite helpful. And I thought if I did have that in previous pregnancies, it would have been a real help in helping me forward.
That's great. Can you tell us a wee bit, Cheryl, about what the differences were when you started your fourth pregnancy? What could maybe been a reason why you didn't have gestational diabetes?
Well, my second and third, I had put on a hell of a lot of weight and was really big. I got away up to 24 stone and wasn't planning having any more children, and I lost all the weight because it wasn't good for my health. I had sleep apnea, I had actual diabetes. I ended up with diabetes because I had gestational diabetes. I was more prone to having diabetes after my pregnancy. So in my third pregnancy I got the diabetes, and there was a lot of different things, and I just thought if I want to be there for my kids, I need to do something about it. So I lost 11 stone, and didn't plan on getting pregnant, but ended up pregnant and still came for the GTT test earlier just to make sure everything was okay. It came back normal and done the wee class, and then came back for my second one, done the class, and everything was fine with that one as well. So I think a big help was losing weight would have been a big factor in not having the gestational diabetes.
My name is Lorna Breeze. I'm a diabetes prevention dietitian working in Esher and Arran. What I'm talking about today is the gestational diabetes framework, so focusing on diabetes prevention, thinking about the gestational ladies. So when we talk about that group, we think that 50% of the gestational diabetes ladies will go on to develop type 2 diabetes within their lifetime. We think of that as a modifiable risk factor, so that means that we can change our risk. The main modifiable risk factor we have is weight. So when we think about the framework that came out from the Scottish Government, which was type 2 diabetes prevention framework, the gestational diabetes fits into this framework. One of the main modifiable risk factors, as I said, is weight, and that's where we come in. So what we're hoping to do in Esher and Arran is a group education programme called Let's Prevent. We'll be offering this to all of the ladies who have gestational diabetes postpartum. So these ladies will be invited to a one-to-one with one of the dietitians, and they'll be assessed for their suitability for the group programme, because we know some people might not be suitable for a group. They might get a one-to-one after that if they're not suitable for a group, but most of the ladies will be going to a group education programme. This will talk about health behaviours that they can change, including weight and other areas that they can change as well. and talking about future risk factors, particularly if people are going on to have subsequent pregnancies.
So as you've said, Ellie, you're 38 weeks pregnant, soon to have this baby as well. Can we talk a wee bit more about the follow-up? I know you're aware that we're going to be introducing the Let's Prevent programme, which we hope that we can do some follow-up with ladies who have had gestational diabetes to try and reduce the risk of developing type 2 diabetes a bit later on. What are your thoughts on a programme like this for postnatally? Would it be something you'd be interested in?
I mean, I think this pregnancy, yes, because again, I kind of lapsed back into my bad old habits following the end of my last pregnancy, and it would be good to have something that kind of keeps me on the straight and narrow, as it were. I had a difficult delivery and postnatal period after my first was born, so I don't know how receptive I would have been to follow up about that. There was so many other things going on, so I think that the timing of that would have been sort of crucial. You know, maybe 3 months postnatally would have been a time where I would have been able to kind of take that on board and engage in it. But then I don't know if you've got an easier birth. Maybe that's too late. You've already gone back into your old habits and you've kind of almost forgotten about checking your blood sugars and what it means to have gestational or, you know, develop type 2 diabetes. So I think the timing would be critical, but certainly having been through it before and knowing a bit about being a mum, I think it would be something that I would really value and hopefully benefit from, because I don't want, gestational diabetes and pregnancy is bad enough without, you know, it impacting on your life and other illnesses beyond pregnancy. So anything that would help address that, I think, would be really positive.
We're trying to introduce a Let's Prevent programme for ladies who have had gestational diabetes for when they deliver, some more follow-up. Do you think this would be something that you would have been interested in?
Aye, it would have been, because see, like the previous pregnancies and everything, you're just kind of left to your own devices. It's like you've got gestational diabetes, go to your 6-week check, you check whether you've got it or not, and if you've got it, it's like that classed as diabetes that you've got then. If not, then like you're just left to your own devices. You don't really know what to do.
So although we are delivering the education, it's the women themselves that are making the change, and I think they begin to realise that they can make the difference, they can make the change, and they can sustain these changes for their long-term health.
If I could give a wee bit of advice to people that's got gestational diabetes, would be to try and lose a wee bit of weight afterwards, because it's the only thing they've got really control over. I know they're going to think, oh, how can you do that, blah blah blah. I thought the same, but I done it. I don't know what happened, it just stuck in my head, done it and lost the weight, and I'm so glad I did, because with my 4th pregnancy I didn't have gestational diabetes. I totally changed everything round about. I went from having type 2, sleep apnea, being really heavy, to losing it all and not having any of them, not taking any medication, not taking anything. It was amazing. I know it's hard and everybody will think it's hard. It is hard, but you can do it.